What is plantar fasciitis? Basically, it is an inflammation of the ligament on the bottom of your foot. The plantar fascia is basically the main support of your arch. So by keeping your plantar fascia healthy, it helps to keep your arch support there. Repetitive stress and excessive stress is the most common thing that we see as far as the underlying cause of these. It's again a straining in the plantar inflammation of the plantar fascia. It's about 10 to 16% of all the U.S. population. It's 1 million outpatient visits per year in the U.S. That's a tremendous number. The most common thing that we see by far is the mechanical, flat feet, wearing poor shoes, things of that nature. But the reason I put this up here is because there are a tremendous amount of reasons that heel pain can occur. And as soon as someone has heel pain, they automatically assume they have plantar fasciitis. But the thing that my job is to differentiate all these other problems. Some of the risk factors, again, unfortunately, women are more common than male. And again, I think it's probably a shoe gear issue. Flat feet or pronation, tight Aquinas is a tight Achilles tendon, and then walking and standing on hard surfaces. Don't go too fast, gradually increase your activity. Obviously wear good shoes, wear good inserts, and that will help to prevent those injuries. Stretch, 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 and when you've done enough, think you've done enough, do it some more. You can't overstretch it. The two that we recommend are the wall stretch. So you put your hands up on the wall and you put your one foot behind you and just kind of keep the heel on the ground, and that will help stretch out the Achilles tendon. The other one is with using either a belt or a towel while you're in bed. Just put it at the end of your foot, not across the toes, but across the ball of the foot, and just keep your knee straight and pull. Pull for about 10 to 15 seconds, repeat it 2 or 3 times, and at that point, and do it 3 or 4 times a day. The American College of Foot and Ankle Surgeons actually came out with a heel pain treatment lab. And it is very, very specific as far as what you do from 6 weeks to 6 months to beyond that. It starts with the basic things like strappings and stretching and over-the-counter inserts, anti-inflammatories. You try that for 6 weeks, and then you go into cortisone injections, custom orthotics. Surgery is really uncommon. I don't tend to do it very often, and I see heel pain, again, 4 or 5 times a day. But it's really indicated after about 6 months of conservative treatment when that's failed.